So, sir, first of all, thank you for organizing such a wonderful event for the patients who has just recovered. Credit goes to you and your team. Everybody does the treatment, takes the fees and forgets, but you are with them even with their journey. Thank you very much. So, sir, my question is: this bladder cancer. This is elderly people's problem mostly. People say 40 plus, 45 plus they are suffering. So how people will initially understand that they may have some complications towards this bladder cancer?
Thank you for your uh, what do you say feedback. See, cancer is a deadly word. It's a frightening word. People get afraid. It's very important to treat them mentally rather than treat with the medicines and operation units, whatever techniques we have. And the treatment starts from this OPD, treating them mentally that don't be frightened with this cancer word. There is treatment, we do our best. Next is to support them. Support them because they need some mental support, they need some physical support. And along with the patient, the family needs support, right? And we are not alone. And this is very important to tell them you are not alone. We are there to help you. We are there to guide you, right? And besides the we people telling, if this thing, same thing is told by the patient survivors who have survived, they have gone through this journey, that makes a more bigger impact on the patients. And that's why we formed this support group, and it's a patient initiative. It's initiative by the patient. We are just the facilitators, and we are happy that it's going in a great way. It's 1 year since we formed this group, and we're meeting monthly. And all the volunteers, all the patients have come in and counsel the patients and treat the patients and help us in guiding them in the right way. And coming back to your question, that is all the signs and symptoms. As I said, it's the most common is passing blood in urine. It's a red color urine, it's a pink color urine, or passing frank blood or clot in the blood urine. That's a warning sign. It can be bladder cancer, and particularly if you are a smoker or used to chew tobacco or gutka, then you are at more risk. Or if you are exposed to some chemical industries or chemicals like fertilizers or pesticides, you are more prone to this. So please don't neglect the symptoms. If you have a history of passing blood with urine, even a drop of it, even once in a lifetime, please get it evaluated.
Sir, is there any screening process to check whether a person is suffering or not? And how frequently a person should check if he or she is vulnerable to this?
So we have also launched a hematuria clinic in our hospital. Hematuria clinic is basically a clinic where we screen those patients who have called hematuria, that is visible blood in urine, or microscopic hematuria, that is they don't have any symptoms, but if you check the urine, they find some RBCs, some red blood cells in urine. That's called microscopic hematuria. So we don't screen all the patients, but patients who are in the age group of 14 beyond, patients who have got a history of tobacco consumption, then we ask for urine test. If there is microscopic hematuria, the ultrasound is part of the screening. Ultrasound is they suggested, then we do cystoscopy. So these three tools, the urine test, the ultrasonography, the cystoscopy, makes a total screening policy for our patients who are at risk of bladder cancer, for not all the patients.
So, sir, normally how many days it will take before clinically conclude that it is a bladder cancer or not, to rule out? Normally this test, how many days it takes?
It's just 1 day procedure, right?
One day procedure.
Urine test takes hardly 2 or 3 hours. Cystoscopy is a 5 minutes OPD procedure. Ultrasound maybe takes around half an hour, 1 hour in hospital. So it's 1 day procedure. Everything can be done.
So in MEDICA, if people comes, they can get the full screening and facilities in OPD.
So you see, in MEDICA, we have also a department of preventive oncology, and this regular cancer screening is a part of this. And maybe we are proud to say that we have tied up with the Kolkata Municipal Corporation also to have a borough-wise cancer screening program for all the cancers. So in that same scenarios, and we have the weekly cancer screening depending on the risk factors, male or female, depending on age and others, the risk factors. We have the cancer screening going on in our hospital. And initially it was free of cost, but we are charging something nominal now for this cancer screening. So depending on risk, if it's a oral cavity cancer, if it's a breast cancer, if it's a cervical cancer, we are doing routine screening for all these patients. And for bladder cancer and prostate cancer, we have dedicated hematuria clinic and prostate cancer clinics.
Thank you, sir. Thanks for your time. Do you have any other question? Thank you.